Bimodality is kind of what it sounds like. It's two different modes of hearing. So in our world, it's really wearing a cochlear implant on one side, which is one type of hearing device, and a standard hearing aid on the other ear, which is a different type of hearing technology. So you've got electrical hearing on one side, acoustic hearing on the other. And it's actually far more common than people think. I think one of the biggest misconceptions would be that this is atypical or uncommon. And in reality, the majority of our recipient community is actually in a bimodal setup. Say one of the misconceptions is that there's going to be this significant delay or kind of this perceivable difference between the two types of technology, when in reality, it's actually a very seamless experience. And as humans, we're really designed to have two working ears. And so it's just a matter of treating each ear with what it needs, and in turn, then really having a really full hearing experience. What it sounds like when someone is bimodal, I like to think of it this way, is really your ears are the pathway for sound, but your brain is the true workhorse of the system. So we're not really hearing with our ears, we're hearing with our brains. And it's at that level that we are really interpreting signals, and the brain's kind of melting together those signals from the two different sides. So what I think of it as is where a cochlear implant on one side is really aiming to restore some of that softer hearing or those high frequencies that maybe a hearing aid was no longer able to reach for an individual. That's really what a cochlear implant's doing. It's helping to do more than what non-surgical technology was able to do. But wearing a hearing aid on the other side that's programmed for that ear is still going to maintain that richness and the fullness that it's able to offer. And so you kind of have the best of both worlds with the two different devices. ReSound is a hearing aid company, and they have a whole portfolio of different hearing aid types and models that have bimodal compatibility with our devices. And it's a really nice simultaneous signal, and the benefit of using both ears for that streaming. What's really wonderful about the Nucleus Smart App is that we've been able to provide patients the convenience of having both hearing aid and cochlear implant control capabilities within one destination on the phone. So a lot of hearing aid users are very accustomed to using an app of some kind on the phone to adjust their devices. But when wearing a ReSound compatible hearing aid and our cochlear implant on the other side, within our Nucleus Smart App, you actually have control capabilities for both. And so that would be volume changes, program changes, and also control capabilities of the wireless streaming accessories. So being able to essentially give each device permission to tune into one of those streaming devices. I think something that's important for our candidates to know is that while there are some really great advantages of having a compatible ReSound hearing aid, and that synchronous relationship can be really desirable, the truth is that any well-fit hearing aid on the other side would be of benefit to our cochlear implant users. You really treat each ear individually for each of its needs. And again, it's going to be at that higher level that those signals are kind of brought together. So wearing a hearing aid from really any company, as long as it is appropriately fit by the audiologist, is going to offer listening benefit.